Hey guys, Dr. Michael Tang here, physiotherapist. In today's video, we will be going over the different types of ankle braces on the market and how to use these ankle braces in different scenarios, such as like an ankle sprain or even if you just came out of surgery. The links to the products that I have here are in the description box below. But anyways, let's go ahead and get started. Starting off with the ankle compression brace or sleeve, I don't really consider this to be a brace just because it doesn't lock you down at all, doesn't provide much stability, but it is really flexible and allows the most mobility of all the different braces that we have on the list here. I would use this particular sleeve mostly for controlling swelling, and if the compression is great enough, sometimes it can be helpful for arthritis. But from a clinical standpoint, it does not give you any stability or lockdown that controls either backwards or forwards or side-to-side motion for that matter. The biggest upside, if you're wearing it, people might think that you're injured, so they might avoid you, which I guess is a plus if you're feeling injured. But the potential downside is that when wearing this, you might feel a false sense of security when in reality it's not giving you much stability and you might hurt yourself because of that. And next, we have the traditional lace-up ankle brace. I would consider this brace to be the all-arounder because it gives you a good amount of stability in all directions. So it protects you from backwards and forwards and side to side. Material-wise, it's typically a little bit thicker than the ankle sleeve that I had just shown. However, I really wouldn't use something like this for cases like arthritis. It's more geared towards acute injuries such as an ankle sprain, or you could even use it post-surgery, say after like Achilles tendon rupture or something like that. And next we have what I consider to be the elastic knit ankle braces. These type of braces are slightly less stable than the traditional lace-up brace, but they're definitely more stable than the compression sleeves. Generally speaking, I recommend these for individuals trying to transition out of a traditional lace-up brace, or if you want to wear it with sports, because these tend to be less bulky and they get less hot in comparison. The particular difference between this brace and this brace is that this one doesn't have the support for the front and back, so it's a little bit more mobile. It allows you to bend your foot backwards and forwards, compared to this one where it's more locked down, similar to the traditional lace-up brace. And finally, we get to the braces where they have reinforced sides. These braces are designed specifically to limit the side-to-side motion as much as possible. Sometimes they're like this brace where we only limit the side-to-side motion and we allow both plantar flexion and all the other motions to happen, or we have something that's more similar to a traditional lace-up brace but is reinforced on the very sides to really give you that lockdown for side-to-side motion. Typically, these braces will be used maybe post-surgery where you had a fusion and you don't want it to move side to side, or perform in a higher level sport, but you really can't have side-to-side motion, but you want to allow maximum dorsiflexion and plantar flexion, such as like deep squatting. But the biggest downside to these kind of braces is that they tend to be the bulkiest and they're not the most comfortable. But if you're looking for maximum stability, at least the side-to-side motion, this is it right here. Like in my other video that I made about knee braces, I'm going to have all the information about different ankle braces and when to use which in different scenarios in an easy to read chart. There's going to be timestamps in the description box below so that it makes it easy for you to jump to what you're looking for. Here I've compiled a chart of the most common ankle problems. Depending on the type of device you're watching this video on, it might be hard to see all the text on the full page. So I put a link in the description to download a PDF version of the whole thing. So if you want to print it out to follow along, you definitely can. How I have this chart sorted is on the left-hand column, we have the potential pathologies, and on the right-hand columns, I have the time frame separated by early, medium, and late-term stages of healing. Meaning a specific pathology will have different recommendations for braces depending on what stage of healing the person is in. And on the bottom, I have the key for what each of the abbreviations mean. But before I go over the chart, I want to put out a disclaimer that all the information that I'm providing shouldn't be considered as medical advice. So please consult your local medical professional to properly evaluate. Alright, now that it's out of the way, let's go ahead and get started. More than likely, if you've ever gotten an ankle sprain, the immediate thought is, I probably should get an ankle brace. And to be honest, me too. That's exactly what goes through my mind. So for those of you who have not had an ankle sprain before, The general description is that it normally hurts, it gets swollen, and it might even turn black or blue. In a low-grade sprain, the ligament itself is either strained or partially torn, and depending on how serious the injury is, it normally heals itself after a couple of weeks, but it is a little scary in the beginning, especially when it's a bunch of different colors. So in the early term, the best bet is to go with something that's a little bit more stable, like a lace-up brace, because they'll give you the support that you're probably going to want. And then as the symptoms start to get better, as in it becomes less painful, less swollen, less discoloration, a elastic knit brace would be a good transition. Finally, by the late stage, you probably want to go with a compression sleeve if there's still swelling, or even nothing at all if it's feeling pretty good. Some people might ask, why don't you just wear an ankle brace all the time, like if you're playing sports, so then you can kind of prevent the ankle sprain. The brace itself does the work of the muscles surrounding the ankle. And so if you do it for a long period of time, the muscles around the ankle will get weaker and weaker just because it doesn't have to do the work of supporting your entire body. Short term sounds good, long term it's not as good. If there's a ligament or tendon rupture, it's a pretty serious matter. A rupture means that the tissue itself essentially broke. Most of the time, it's going to require some surgical intervention, and after surgery, the patient will likely be put in a boot for 6 to 8 weeks. And when they finally come out of the boot, that is really when an ankle brace will come to play. Because after being in the boot for such a long time, it's pretty much a certain guarantee that the ankle and foot muscles are going to be super weak. So therefore, going with a lace brace would be recommended. And then as the muscles get stronger during rehab for a couple of weeks, slowly transitioning to something a little bit less stable and encourages muscle strengthening is where a elastic type of brace would be a good fit. If swelling is a problem, then maybe some compression wouldn't be a bad idea either. Achilles tendinitis just means that the Achilles tendon is irritated, leading to inflammation. There really isn't that much to say about it. Ankle braces are used primarily to limit the amount of ankle dorsiflexion. If the tendinitis is really minor, it's actually beneficial to encourage a little bit of stretch onto the Achilles tendon to help speed up the healing. Normal day-to-day walking would achieve that, but if you're really dead set on getting a brace, a loose elastic knit brace or even an open ankle brace could be helpful choices since they both allow for a little bit of ankle dorsiflexion. Now, if the tendinitis is really severe, then limiting the amount of ankle dorsiflexion would be more comfortable because that would mean there's a reduction in stretching stress on the Achilles tendon. A lace-up brace or a tight elastic brace would work since they both lock your ankle in place from moving at all. In these cases, most people wear the braces because it gives them a sense of comfort, but if we're talking about clinical effectiveness, it is questionable at best. Like other tendinitis, this has to do with the inflammation of the tendon, typically from overuse. The anterior tibialis does both dorsiflexion and ankle inversion, and the peroneal muscles have the primary function of ankle eversion, meaning these muscles control the side-to-side motion of the ankle. Braces for these problems are all about controlling the side-to-side action. For most cases, an elastic knit brace should work well enough without being too restrictive. In cases where the tendinitis is severe, a lace-up brace is best for maximum lockdown. And if it's really minor, maybe considering a reinforced side brace or open ankle brace might be a good option since it allows for plantar flexion and dorsiflexion, but restricts the side-to-side motion of inversion and eversion. I wasn't even sure if I should put this one on the list, but I figure it's common enough, so you know what, why not? The pathology of plantar fasciitis happens when the plantar fascia on the bottom of the foot gets inflamed, usually with chronic overuse or deterioration, generally at the insertion point of the calcaneus. Symptoms of pain come up when the weight is put through the foot, so really a brace is not going to stop the force from going through the calcaneal insertion. However, there is some research to suggest that the plantar fasciitis is associated with lateral ankle instability, so maybe wearing a brace for that reason would work. But overall, for plantar fasciitis, ankle braces are probably not the answer. In the case of arthritis, whether it's osteoarthritis or rheumatoid arthritis, these pathologies are more related to deterioration of the bones, meaning the pain is generally associated with compression. Unless there's so much deterioration where the joints are becoming unstable, most likely an ankle brace is not going to be clinically helpful. But some people will wear a brace for the nice feeling of compression, so that's why I have a maybe on the elastic knit brace. You'll see on the chart that I have ankle impingement for both front and back and side to side. I decided to split up the sections up because they are their own separate problems. The term impingement itself means that there are structures pinching on each other. Most of the time it's joints pinching on each other, but sometimes it's because there's not enough space in between the joints, almost like arthritis. Or maybe the joints aren't moving because the capsule is stiff. There's really a ton of different possibilities. In the case of impingement from the front to back part of the ankle, we want to allow as much dorsiflexion and plantar flexion as possible, which makes braces like the open ankle brace ideal for this type of scenario. Braces to promote side-to-side motion outside of normal ankle motion really are not recommended or effective, so it's probably better off just not wearing anything. A better bet is to see your local physio, who probably would be way better and more effective in dealing with this particular problem. When I say fusion/hardware surgery, I'm talking about when the joints are surgically put together, either through positioning or hardware. Generally, after surgery, the ankle will be put in a boot to be locked down, and then after coming out of the boot, there's probably going to be some swelling and atrophied muscles. The main goal in this scenario would be to control the swelling, increase the strength, and slowly reintegrate the motion back into the ankle complex, meaning that the elastic knit brace would be the best for this job, especially since it has good compression. A lace-up brace to lock it down probably would do more harm than good, but overall there are some cases when it would make sense. It would be best to go with the advice of your local medical professional. If there's recently a fracture and it hasn't been treated medically, using a lace-up brace would be the best choice for the meantime while waiting for medical attention. It is not okay to replace a cast with a lace brace because it simply isn't restrictive enough. Fractures of the bones in the ankle will normally be casted by the physician for 6 to 8 weeks, and then after coming out of the cast and the bones are healed, normally that is when rehab starts. At this time, it would be best to go with a elastic knit brace because we want to promote as much mobility as possible while still providing a little bit of stability. As the ankles get a little bit better, slowly transitioning to either a compression sleeve or nothing altogether is the normal progression. Dislocation of bones is a really serious matter. It probably goes without saying that the first order of business is to put the bones back in place. And then after that, after all the swelling and pain and all that has come down, the main issue is going to be joint instability. So braces that give the most lockdown, like a lace-up brace, are going to work best. After some time in rehab, maybe transitioning to an elastic knit brace would be preferred since it's a little bit less restrictive, but it's still supportive. Hopefully this video was helpful in helping you understand what kind of ankle brace you should use for which different scenario. But as a recap, in general, the type of ankle brace you should use is dependent on timing. If it is a very acute injury, then you might want to go with something with more lockdown, such as the ankle stabilizer. And as you transition out of it and you get a little bit better, you might want something a little bit less restrictive, such as the elastic knit one or the compression. And then in special cases, you might want to get a reinforced sides brace. But ultimately, you want to not use any braces at all, and that would be the final goal. And once again, all the products I went over in this particular video, they are in the description box below. And leave a comment below if you have questions on the different braces that I have here, or if there's another topic that you want me to go over in another video. But other than that, thanks for watching, and I'll see you guys in the next video.